Hello, good night. I am going to discuss spinal canal stenosis. Spinal canal stenosis. So, what is spinal canal stenosis? Spinal canal stenosis is a narrowing of neural foramen, lateral recess, and spinal canal. So, it is the narrowing of three sites: neural foramen, lateral recess, and spinal canal. So, this is the anatomy of the vertebra, and we can see here this is the vertebra, and this is vertebral foramen, and this is superior articular process, and this is inferior articular process, transverse process, and spinous process. So this is facet joints, and this foramen is intervertebral foramen. We can see here also, and this is intervertebral disc. We can see spinal canal. This is the spinal canal, and this is the spinal cord. This is intervertebral disc. Here are two things. One is annulus and another is nucleus. The nucleus centrally and annulus at the borders of intervertebral disc. So intervertebral foramen, we can see annulus fibrosus, nucleus pulposus. So what are the types of spinal canal stenosis? There are three types of spinal canal stenosis. One is lateral, another central, and last one is foraminal. So this is the spinal canal. When the spinal canal is stenosed, then it is called central type of spinal canal stenosis. When the intervertebral foramen is stenosed, then this is called when the intervertebral foramen is stenosed, then it is called foraminal stenosis. And the lateral part of the spinal canal is called lateral recess. So this is lateral recess. When this part of, that means the lateral part of the spinal canal is stenosed, then this is called lateral recess stenosis. So when this part is stenosed, then this is called lateral recess stenosis. And this is the intervertebral foraminal stenosis or foraminal stenosis. And here central spinal canal stenosis. Here the ligamentum flava is hypertrophied, so it is compressing the uh, spinal canal. So what are the presentations for spinal canal stenosis? The main type of spinal canal stenosis is central canal stenosis. Here the patient might have neurogenic claudication. Patient may have leg pain, back pain, buttock pain, weakness, cramps of the calf, and heavy sensation. And leaning forward increases the foramen size by about 12%, and due to this, the leaning forward relieve the symptoms of lumbar canal stenosis, and leaning backward reduces the foramen size by about 20%. So leaning backward or straightening of the spine brings the symptoms of lumbar canal stenosis. Here we can see shopping cart syndrome or shopping cart sign. In this sign, the patient might have difficulty during standing positions or during extension of the spine. Patient might have neurogenic claudications or pain or numbness of the both lower limbs. But when the patient lean forward, lean forward, and do even when do heavy exercise by leaning forward, patient will feel comfortable, and patient and this condition will relieve the symptoms of neurogenic claudications and relieve the symptoms of the pain, cramps, weakness, or numbness. Now, what is the difference between neurogenic claudications and vascular claudications? The main thing is neurogenic claudication exacerbated with extension of the spine, like walking downstairs, standing upright, and vascular claudication is exacerbated with exercise, like walking long distance or stationary bike exercise. And the neurogenic claudications relieved with flexion, like sitting, leaning on the shopping cart or stationary bike with back flexed. And vascular claudications is relieved with taking rest, like stop walking and stopping exercise. In neurogenic claudication, pulse will be normal and shopping cart sign will be present, but in vascular claudication, both will be absent usually. And so this is the picture the showing few causes for lumbar canal stenosis. Here the ligamentum flava is hypertrophied and compressing the central spinal canal. And here the intervertebral foramina, it can be compressed by bony spurs or osteophyte. And lateral recess can also be compressed by this, and this is the prolapsed intervertebral disc, which is bulged or herniated, causing compression. There might be several causes for this. Even Paget disease can cause compressions like this way. So what is disc herniation? The herniations of intervertebral disc is the protrusions of the nucleus of the disc into the annulus with nerve compression. So here we can see this is the nucleus and it is displaced and it enters into the annulus fibrosus. So herniations of the nucleus into the annulus is called the disc herniation. So this is the normal disc, sorry. This is the degenerative disc and bulging disc, herniated disc and thinning of the disc, and there are disc degenerations with osteophyte formations here. This is the osteophyte. Okay. So what are the differences between the bulgings and herniation? So basic difference is how much circumference are affected. Here the more than 90%, more than 90 degree of circumference are affected in case of bulging disc, and here the less than 90% of circumference are affected in herniation. So when uh, a disc of occupy usually 360 degree, okay, a disc circumference having 360 degree. When more than 1/4 is affected, this is called disc bulging, and when it affects less than 1/4, that means that less than 90 degree, then this is called disc herniation. So the bottom two are disc herniation and the up two are disc bulging. So disc bulgings are two types. When the whole of the disc are involved, then this is called symmetrical bulging disc. When less than 360 degree, or when the whole of the disc not involved, then this is called asymmetrical bulging disc. And herniation also two types. Those two are herniation and those two are bulging. Okay. So herniations also two types. One is protrusion and another is extrusion. So what is protrusion? Protrusions means when the disc head is narrower than the disc neck, then this is called protrusion. But when the disc head is broader than the disc neck, or disc neck is narrower than the disc head, then this is called disc extrusion. So disc bulging uh, project beyond the margins of adjacent vertebral bodies over more than 90 degrees of circumference. It can be circumferential bulge, involves the entire disc circumference, and when it does not involve the entire circumference, then this is called asymmetrical bulging disc. And disc herniation refers to the displacement of intervertebral disc material beyond the normal confines of the disc, but involving the less than 90% of the circumference. So Those two are disc herniation. Disc herniation because those conditions affected less than 90 degrees of circumference, and this is the disc protrusion, and this is the disc extrusion, and this is normal disc, bulging disc, protruding disc, normal disc, bulging disc, protruding disc, and extrusion disc with extrusion.